Hello again, Dr. Suleiman here, Chronic Pain GP. I'm back from a short break, and this next series of videos is concentrating on the common pain conditions or syndromes I see on a day-to-day basis. I've decided to start off with one of the most common conditions I see, and particularly one which has been in the media recently, whether it's on social media or in the print media, and that is a condition called fibromyalgia. So if you start at the beginning, the word fibromyalgia is from the Latin, which essentially means pain of the tissues and muscles. Now, way back in 1991, the American College of Rheumatology defined fibromyalgia, or advised clinicians that the best way to diagnose this is by palpating 11 out of 18 tender points on both sides of the body. However, that classification has now evolved, and it's usually diagnosed through a combination of parameters, and these are as follows. So often the diagnosis is a combination of chronic widespread pain, cognitive disturbance, which often includes word finding difficulties, or what patients commonly refer to as the fibro fog, unrefreshing sleep. Now, patients can sometimes explain that they can sleep for many hours without being disturbed, but when they do wake up in the mornings, they feel unrefreshed. And then there's a combination of symptoms which we describe as somatic symptoms, and these are, for example, conditions such as IBS, migraines, heartburn, bladder disturbance, and menstrual irregularities. And if you put all those together, essentially you have a diagnosis of fibromyalgia. Now, this condition is definitely more common in females, with a ratio of about 7:1, and the average or usual age of onset is between the ages of 30 or 50, although I have seen it in teenagers and in those above 50. However, the most common age presentation is between the ages of 30 and 50. There are some conservative estimates that it could affect as much as 5% of the population. So that would be obviously 1 in 20 of the population. And I often get asked about the cause of fibromyalgia, and in essence, there is no obvious cause at present. However, research is ongoing, and as described in my previous videos, I do feel that there is probably a autoimmune component, or a hormonal component, or perhaps a combination of both. I certainly feel that there may be some genetic involvement here, with a combination of environmental factors as well. There's certainly associations with fibromyalgia, and the most common ones I find is that it's often associated with depression and anxiety, or there's often association with previous moderate to severe physical or psychological trauma. I often find that if I delve deep into the history with a patient, I can often elicit a history of a severe accident, perhaps a severe physiological illness, or often more commonly problems with domestic violence and child and sex abuse. Now, clearly these issues need to be dealt with empathy and sensitivity. How does it impact on patients? Well, I would say that there's a spectrum here. Some are extremely debilitated by fibromyalgia, however others can continue to have what would be described as a productive and active life. And on that spectrum, patients can sit on various aspects of it. Another common condition where I feel there's some overlap with fibromyalgia is chronic fatigue syndrome. However, in my experience, patients with chronic fatigue syndrome definitely show more evidence of severe tiredness and exhaustion, and perhaps some chronic widespread pain, whereas on the other end of the spectrum, fibromyalgia patients certainly have more pain and perhaps less fatigue and tiredness compared to chronic fatigue patients. What I certainly have found is that often there is a pattern to what we describe as fibromyalgia flares, and this could be something as a small minor illness. However, it definitely occurs during periods of anxiety, depression, where there's been a loss or bereavement. And I find there's also often flares where patients are having issues perhaps with work-related bullying or stress. Now, the management is often quite complicated. often an element of trial and error involved. But what I do know is it's a multidisciplinary approach, including chronic pain physiotherapists, occupational therapists, clinicians, psychologists. But I split this down into management, which is pharmacological, and non-pharmacological. So non-pharmacological first. Often gentle stretching, exercise and strengthening are the mainstay of treatment. Definitely has to be some lifestyle changes, which include slowing down, relaxation, meditation. Talking therapies can often help, particularly if there are deep-seated issues with psychological hurt. And definitely alternative remedies can sometimes be tried, perhaps, such as CBD oil. Pharmacologically speaking, amitriptyline is often first line, a drug which is not without side effects, but is quite effective and relatively cheap for the NHS. Gabapentin and pregabalin, although have been recently reclassified as class 3 drugs, are still have a role in fibromyalgia, in my opinion. And then there's other medications such as the serotonin, noradrenaline reuptake inhibitors, such as duloxetine, which can be also helpful. So in summary, fibromyalgia is a fairly common condition that I see in pain clinic. I often feel it's underdiagnosed and in some ways undertreated. However, there is lots of information online available, and I'll put some links in the comment section on the YouTube video. There's also some information available on my website, which is oliveholistichealth.com. The video next week will be concentrating on a more rare rheumatological condition, which is called lupus. In the meantime, please remember to like, subscribe, share far and wide, and please leave me any feedback down below, or if you have any questions, and I'll try and respond as soon as possible. And thank you once again for your time.